My name is Carey Blaik and I'm the Clinical Director at Our House, Our Haven, which is a mental health nurse-led community-based clinic in Carey. I did my hospital-based training at Wolston Park Hospital back in the 90s, and then I worked in several different hospitals and in all areas of psychiatry and hospital and community, consultation, liaison, emergency, you name it really. When I left the hospital, I worked under a program called the Mental Health Nurse Incentive Program, which was run out of a GP surgery. So I discovered there that people with mental illness often don't get very good care in the current system, or not the level of care that they deserve. I'm someone who believes that every person has the right to safe, effective, caring and consistent mental health support, regardless of who they are and where they come from. I'm also a nurse, so a person of action. I believe that people's right to good health care so much that after years of being disillusioned within the system, I knew I had to do something about it. So I put my time, resources, money and career where my mouth is, and together with Beth Porter, I founded Our House, Our Haven in 2016. We offer a safe community-based place. We're on 2 acres in the country Carey, just outside of Ipswich. So it's a quiet, calm, peaceful place. I wanted a place where people could come to and feel safe and feel supported in a non-judgmental and inclusive environment. Our House, Our Haven's been running here at Carey for about 3 years now. And in that time, we've seen hundreds of people. They come for varying lengths of time. Most of the people who come here, well, all of the people who come here initially get referred by either a GP or a private psychiatrist, which is, and when that sets up that, again, that circle of therapeutic safety around them because they've got a team. But here they get the one-on-one long-term support. We do psychotherapy. We also have a strong community base. We have shared meals on Fridays. We've got a beautiful garden, so we go and pick food from the garden and prepare it and eat it all together out there. And we've got animals. We've got lots of things that people can do. When people come to us, they usually have experienced a great amount of trauma in their life. So everything that goes with that, they're usually chronically suicidal, self-harmers, really have difficulty with regulating their emotions and keeping relationships and everything like that. So the outcomes that we get is that people are more able to manage what they're doing. And what we try and do is give them a safe space to discover who they are and work out what their journey is to health. The advice that I would give nurses, if they can see a better way of delivering healthcare, is to try different things. It's important to especially as nurses, because we are our own therapeutic tools, basically. We see something, we work with people. That's where our strengths lie. And if we can come up with better ways of doing things, then we should at least try to do them. Be brave, take risks, rely on yourself and the people around you, and use the skills that you have, we all have, because it's no good waiting for somebody else to come up with the ideas. The systems are too clunky for that. It has to be up to each of us to do what we know that we can do. It's really exciting. I feel like I've been working towards what we've created out here for the last 20, 30 years, really, in my heart anyway. And so to get some recognition, and maybe this opens up doors so we get some funding, I don't know. But just getting some recognition for what we've achieved out here is so exciting. The Nurse Trailblazer Awards are really important because it gives nurses some recognition for the work that they do outside of all of the systems that are already in place.